Hi, Mike Gibson coming to you live from ESC 2018, and I'm joined by Jean-Philippe Collet. We're talking about the France-TAVI registry. Talk to us about your experience in France and antiplatelets and anticoagulation, how you're all trying to sort all of it out.
Well, first I would like to give several words about the registry, which was launched in 2007, to have some kind of feedback on outcomes with this new intervention. So we have a huge number of patients, and usually we looked at, baseline characteristics, echo findings during follow-up, and also mortality in the long-term outcome. And the idea of this study was to analyze late mortality and early bioprosthetic valve dysfunction after successful TAVI according to treatment at discharge, whether the patient is on anticoagulation or not. This was, the hypothesis behind was that anticoagulation may reduce, I would say, bioprosthetic driven events and non-bioprosthetic driven events. Mm-hmm. This was the idea behind
And this was non-randomized, this real-world data collected?
Right, yes. Right. Yeah, we have echocardiography data, and we have survival with the French National Institute of Statistics. So we have robust events that are non-adjudicated, mm-hmm. non-self-declaratives, mm-hmm. So it's robust data.
Sure. And so 11 years of data now. How many patients are in the registry?
So we looked at patients who were in the registry between January 2013 up to December 2015, and this was 13,000 patients.
Wow. That's a lot of TAVIs. And what were some of the trends that emerged?
Well, we had the full survival data on 90%, and the one for whom we did not have the data were those without known antithrombotic treatment at discharge, or the one who died during hospital stay. Mm-hmm. So roughly we had 40% of the patients who were discharged on oral anticoagulants. And we looked at baseline characteristics, and we found, of course, that the main reason for anticoagulation was atrial fibrillation. So there were more comorbidities, and there were also some differences in terms of procedures with more non-femoral access TAVR. And we looked at the independent correlates which are associated with the use or not of anticoagulant. And we found, interestingly, that there are many independent correlates, of course, which were already known, and that both atrial fibrillation and anticoagulation at discharge were associated with mortality. But these two variables vary collinearly, but yes, they remain independent. And the question behind is whether anticoagulation itself is detrimental or whether it is because of the indication. So the question is not fully sorted out because there are probably unknown confounders that we do not know about, and this is why we need randomized evaluation.
Do you have many people who didn't have atrial fibrillation who were put on anticoagulants or not?
The one who are not on atrial fibrillation has baseline characteristics. We had few patients who were, I would say, with new onset atrial fibrillation, so they had anticoagulants. And also in this survey, we had about 10% of patients with crossover. Mm-hmm. And they were crossed over either from anticoagulation to antiplatelet therapy, but also vice versa. So it's a complicated issue, and this is why we need randomized evidences. And on the other hand, we looked at bioprosthetic valve dysfunction, which is mainly related to valve thrombosis, and we found that anticoagulation was associated with less bioprosthetic valve dysfunction. This was known, but this was confirmed in, I would say, a big sample size population, more than 2,000 patients.
Which is a little bit at variance with what you're saying about worse outcomes with anticoagulation.
Right. Yeah.
So,
and the missing link is between bioprosthetic valve dysfunction and, I would say, mortality or stroke. And we do not know whether there is some relationship. So it's like a two-edged sword, I would say.
Exactly. Don't want to get cut with a two-edged sword when you're on two antiplatelets and an anticoagulant. All right, Jean-Philippe, well, thank you for joining us. That was a great update. And thanks to all of you for joining us here live from ESC 2018.